So I'm here to show you today how to do the step-by-step process in order to revive somebody that's experiencing an overdose. So the first step to responding to an opioid overdose is recognizing one in the first place. And the way that you'll be able to tell that someone might actually need Narcan is by checking if they're responsive. If they're able to respond to you, and a response doesn't need to be full sentences, it doesn't need to be coherent, it just needs to be a response. A grunt that sounds like it was intentional is more than enough. And there's a lot of ways that you'll hear people talk about finding responsiveness. There's all kinds of old versions that include, injecting someone with various substances, putting ice cubes in various places. But for our purposes, and because we want to reduce the likelihood of injury and make it as easy as possible and quick as possible, we're going to use a sternum rub. So to do a sternum rub, you just take your knuckles like this, these knuckles, and you rub really hard on the person's sternum. And you really don't be afraid to dig in there, because what it's going to do is cause like a little bit of pain, and it can be pretty painful. And that's kind of the goal, is it's painful, but it won't cause any long-term injury. The worst that you may do to them is they might get a little bit of a bruise or a little bit of a rug burn from their shirt, but you're not going to break any bones, you're not going to dislodge any teeth, and so this is ultimately the best way to check for responsiveness. So next we want to give them the Narcan. So the nasal Narcan looks like this. This is one dose. Each box comes with two. What you do is you peel this piece back here to open it. There's just some instructions there. And then this is your one dose of Narcan. And how you use this is you're going to take it and stick it up someone's nostril as far as you can, but don't have to jam it up there. We don't want to hurt nobody. And then you just press this button on the bottom. And I call it a button because it's not like, a nasal spray, like a saline spray you might use where there's some resistance and you can, feel the pressure, you can push it fast or slow. This is not that. This button will just click, and when it clicks, all of the medication is sprayed into the nasal passage. It takes about 2 to 5 minutes to work. And so that can be a long time for someone to not be breathing properly. So during that 2 to 5 minutes, what we want to do is rescue breathe. And so to do that, we're going to make sure that we've got their head tipped back. This opens up their airway so that the air that you're blowing into their mouth can actually make it to their lungs. You're going to plug their nose so that all the air that you're blowing in their mouth doesn't come right back out their nose. And then oftentimes, especially in a fentanyl overdose, it will be pretty necessary to hold their mouth open. So once you've got them in this position, you got their chin down, their nose plugged, their head tipped back. You're going to do 2 breaths to open up the lungs, and then 1 breath every 5 seconds. The big thing to look for when giving these breaths is you should see their chest rising when you're giving them the breath. If you don't, just double check. Make sure you got their head tipped back, their nose plugged, their chin open. Another thing you can double check if all those things are in place is make sure there's nothing blocking their airway, nothing in their mouth. After about 2 minutes, if they're not coming around, maybe you do another sternum rub, try to see if they can respond. If nothing's changing, they don't seem to be waking up, they don't seem to be breathing better on their own, that's when you're going to give another dose of Narcan. Again, it's the same process. You're going to put it up a nostril, click the button. If you can remember what nostril you used previously, some people recommend using the other nostril, but it's not a make or break thing, so if you can't remember, it's totally okay. The name of the game is getting the medication into the person. And then after you give that other dose, we're going to repeat again. We're going to do some more rescue breathing. Make sure their head's tipped back, nose plugged, chin down, nothing in their mouth. Do 1 breath every 5 seconds again for another 2 minutes. So really the goal is to get as much of it into the community as possible so that the most people can reverse an overdose and save a life.